Good morning, everyone, and welcome to our first webinar of the spring. And we're delighted that you've been able to join us this morning. My name is Sarah Browne, and I'm one of the trustees of Hourglass. Hourglass, or as some of you might be more familiar, Action on Elder Abuse. We are celebrating our 30th anniversary this month. So we are delighted to be hosting this morning's webinar. Hourglass is one of the only UK charities focused on putting a stop to the harm, abuse and exploitation of older people, and at the same time committed to creating a society where older people can age safely and free from abuse. It is estimated that probably something over 2 million older people are subject to abuse, and that's a staggering 1 in 5 or 1 in 6 older people. So it's important that we continue to raise awareness of the prevalence of abuse, the signs and symptoms of abuse, and ensure that people are confident to know how to raise concerns when they're worried about an older person, whether that be a family member or a friend or neighbour. In Hourglass, we run a 24-hour helpline, and again, it's the only dedicated elder abuse helpline. And through the helpline, we offer support and advice to older people and their families. And now more than ever, it's important that we continue to raise the needs of older people and to lobby central and local governments to ensure that their needs become widely known and addressed. This morning, I'm delighted that we have 2 panellists with us. Unfortunately, one of our panellists had to withdraw this morning, and so it is not the format that we were intending, but I think we have 2 very experienced panellists. We're hopeful that in the audience there'll be people who perhaps will want to ask questions and perhaps share any concerns or issues on this subject. This morning we're going to be looking at the role of personal assistants and how that varies across the UK. In particular, we're wanting to look at the issue of the fact that personal assistants are not regulated, and does this have implications in terms of giving rise to situations of risks of abuse. But on the other hand, we are very aware that the role of personal assistants is vital for many, many older people and empowers them to have much more flexibility, choice and control over how their care is delivered. Before I proceed to introduce the 2 panellists to you this morning, I just want to remind everyone that we are recording this morning's webinar, and it will be available after the event in the next couple of days on our knowledge bank. And it's there for you to watch again, or perhaps to share with some of your colleagues who have been unable to make this morning's webinar. During the session, we have a question and answer box. So if you have any questions on what you're hearing or something that you would like to raise with us, we will try to address those as we go through the webinar. And if there's something that we can't address this morning, we will follow up and respond to you after the webinar. So at that point, if I could maybe ask our panellists, when they're introducing themselves and their background and their organisation, and they're going just to say a little bit about their experience of personal assistance and direct payments and self-directed support, then we'll lead into a few questions. Thank you. So if I could hand over, Carla, first to you.
Well, good morning, everyone. My name is Carla Bevan. I am the Deputy Manager for an organisation called the Centre for Independent Living based in Northern Ireland. We have been up and running just over 20 years, And we are an organisation run by disabled people for disabled people, working particularly to promote principles of independent living. And we provide a range of services highly focused on supporting those using direct payments or considering using some form of self-directed support. We are contracted by the Department of Health here to provide that advisory service to anyone undertaking a direct payment, and we would help that person negotiate the base that is direct payments here in Northern Ireland and all of the things that they need to put in place to ensure their direct payment will run smoothly. That's part of our advice service. Over here, if you're a direct payment employer, you also need to consider your employer obligations, and we would ensure that people understand those. And we do offer a payroll service as well for reporting your personal assistant, which are technically your employees' earnings, to HMRC. We've also started to particularly focus on personal assistant recruitment, and we have bespoke training for our advice team in ensuring safety when recruiting for a PA, particularly if it's outside of your family. We also have an account service here at the centre, so you have a budget that you're given by your health trust to run your care provision, and we would help you budget that to ensure you're meeting all of your overhead costs as an employer, and to ensure that your employees are getting all of their entitlements as they continue to work with you. And finally, we do a lot of training and outreach work. So we do outreach work in terms of linking in with community organisations to spread the word about self-directed support and how we can support someone doing that. And we also actually train a lot of the social work teams across the health trusts here in Northern Ireland as well, because self-directed support is not part of mandatory training within a social work degree, or if you're coming in under a community practice nurse or a key worker. Some teams have very little knowledge, which is why we're contracted, but it's also us training those teams so that their service users are getting the best possible advice when they're deciding how they receive their care. So that's what the centre does, and I hope that covers everything, I think.
That's lovely. Thank you, Carla. And then if I could ask to our second panelist, Elizabeth.
Perfect. Thank you, Sarah. Good morning, everybody. My name is Elizabeth Fox. I'm one of the community response / independent domestic violence advocates for Hourglass. I'm part of the Community Response Hub based in the south of England. This was launched 18 months ago as an extension to the Hourglass's Helpline. We are an ongoing support where we provide dedicated casework to individuals who may need some sessions and some advice and signposting, maybe liaising with other services or supporting through the court system, receiving non-molestation orders and other support systems like that. So that's what I've been doing for the last 18 months here within Hourglass. I'm also the founder of Nightingales Army, a community interest company with the vision to actively raise the standard of care by recruiting, retraining, rewarding and representing healthcare assistants. We believe that healthcare assistants should be provided a standardised training and awareness before entering the job role so that we are not putting vulnerable people in to work with vulnerable people. We'd like to reduce the amount of hospital admissions by raising awareness and understanding about the care being provided to people within the care homes and out and within the community as well. So that's our aim at the moment, and it's really good to be here today to discuss some of the questions we've got going forward. So thank you, Sarah.
Thanks, Elizabeth. And if we maybe go to the first question, and I think both of you sort of referenced it slightly, but perhaps now obviously we're not going to be looking at all 4 nations because we've represented here this morning England and Northern Ireland, but if there's anyone in the audience who is from Scotland or Wales and wants to advise us what the situation is for those nations, please do feel to pop some information into the question and answer box. But I suppose maybe starting, Carla, in relation to Northern Ireland, if you could maybe outline what the differences in regulation are for personal assistants compared perhaps to other domiciliary care workers and other workers who might be providing care to older people.
Sure. So, I mean, if you're talking under the umbrella of personal care assistance or personal assistance, which is under self-directed support, There is very little, there's no standardization, there's no register for those PAs to be on. There's no obligation to register with Northern Ireland Social Care Council. There's no regulation by RQIA, which is our main regulator here for care providing companies. What is there in its basic form is if you choose to become a PA under a direct payment, you will have an enhanced access NI check done, which is a police check, and it's the enhanced version, which I think kind of takes in more time. That has to be done as a potential worker and approved by the trust when it's returned that there are no red flags on your police check, and that is literally it. There's no mandatory training required for you to take the post. Now, if an employer is advertising out for someone very specifically trained, that person can have that background. So when they come into that care package or that employment, the trustee have a duty to ensure that training is met if there's an identified training need. But outside of that, there's no mandatory training that's required, full stop. So you could go into someone's house where they are using a rollator or a Serra-Steady or a hoist, you will get that training with the trust. But if it's outside of that personal care, there's no standard training met. That's very different if you're a care assistant working with a provider or a care company. Those staff will have mandatory training. They will have specialised training where appropriate, and they are shadowing other experienced workers, and they're signed off before they can go out and do manual handling or medical care tasks. That's not the case with personal assistants. So, and if you're an employee with a care provider or company here, you have to be NISC registered. And obviously with that, you're an employee with a care company, so you are spot checked by your seniors. You have certain goals that you have to meet with your training. All of that is done as a care provider employee. If you're a personal assistant, other than training identified for the specific person, the only thing that's required is the Access NI police check, and that's literally it.
Okay.
So a huge difference.
Yeah. That's very clear. Thank you, Carla. And Elizabeth, in relation to the situation in England, which obviously you would be familiar with.
Yes, at this set, there's no set entry requirements to become what we would call a healthcare assistant. So at the moment, I find personally there are some discrepancies between personal assistant and a healthcare assistant, whereas we would see a healthcare assistant go into a care home and be providing hands-on duty and supporting an individual. They may receive the care certificate when entering the care home, which again is not a mandatory certificate. So it's not something that the care homes have to provide. It's just something that they are providing to ensure that they're meeting a certain set of needs. But it doesn't cover all the basis. It's not fully inclusive of everybody's well-being. It's not covering all different types of care management or different ailments that somebody may be experiencing. So it's a very baseline course that somebody may be taking before they enter the home. But like I say, that's not a set requirement. That's just something that the care home may provide an individual before they enter. And we have discrepancies with that as well. As Carla mentioned, people do buddy up with people, but we find when somebody is buddying up with someone on the floor, then you have discrepancies between the training that's being provided. You may find that somebody has been trained not with the care certificate, or someone has been trained with the care certificate, and you buddy up with these two different people, and then you've got discrepancies between the training that you're receiving from that other individual as well. So it's very difficult to pinpoint a direct route into the care system because there isn't one outlined at the moment. It's all a little bit hit and miss, unfortunately. And when we talk about personal assistants, we don't think of a personal assistant as somebody who's going providing hands-on personal care. A personal assistant, in my eyes, and from what I've discussed with my other healthcare assistants and colleagues, would be somebody that's just merely providing some bookkeeping and preparing for events and doing things like that. So it wouldn't be personal care. There wouldn't be anything hands-on in that sense. It would merely be taking them out for daily management or planning activities and things like that. So we've got a few discrepancies there between the different titles for an individual's job role, as well as the requirements that come into that as well.
Elizabeth, in England, if someone is receiving direct payment and is receiving care from a healthcare assistant, but receiving it in their own home and being paid directly by the older person or their family, what are the regulations there?
Yeah, so that would be slightly different. So that would be having somebody come in if you were paying directly a relative to look after you. then you would need to be an employer yourself. So then you would need to set up the employment care package. You would need to open your bank account, things like we discussed earlier on prior to opening this. And it's very, very difficult for an individual to do that and have their money come out of their package of care to pay for that care support worker. They'll need to make sure they've got enough money backed up for respite care. You know, if anything goes wrong, any holidays that individual must take. So it's a very difficult route for an individual to go down. We tend to find that a lot of people provide unpaid care to a family member. So they would be receiving a carer's allowance. They may have carer's support assessment from one of the care charities, and will be providing care in that manner, but it wouldn't come directly from a payment of the person that's receiving the care. It would come from the assessment.
Thank you. Carla, just given what you outlined in terms of the role of the personal care assistant in Northern Ireland, what impact do you think that this may have on the care of older people?
Sorry, you cut out a wee bit there, Sarah.
Oh, sorry. Right.
You're okay.
I'm just asking, in Northern Ireland, in terms of personal assistance and direct payments or self-directed support, what impact do you think that might have on the care provided to older people?
Yeah, but I mean, I suppose there's many ways of looking at it. If you are simply an elderly person and with very little support have decided to take through word of mouth a personal care assistant into your home, well, you don't know anything about them, their background, you've no character reference, the police check will be done, but you know, so it can leave someone very open to being exploited. It can leave someone who's very vulnerable open. What we try to do is, if we get people, particularly elderly people, come in our direction who sometimes do have family support and sometimes they don't, we will very heavily focus on helping them recruit safely for a PA and ensuring that all of those boxes are ticked so that they have a reference, they have their police check, they have a background. As much as you can safeguard someone in that position, you will help and we will help and assist them to do that. But that's only if they come across our door looking for that support. You know, there are people out there who would just go off and within their local community recruit, and we've no way of knowing who they are, and therefore we can't offer them that support. So while the personal assistant, it's very much a coin of two sides. It's hugely beneficial to enable someone to remain independently living within their own home if they can recruit a personal assistant to help them do that. But the offset of that being that there's no regulation and there's nobody there overseeing. Now, there is a duty on the trusts here, and the trusts do monitor direct payments quite heavily. When a new direct payment, for example, is set up, the police check is obviously done via the health trust. Within a 3-month period, that's reviewed. So the social worker would meet the person in receipt of the support in person to see how the direct payment in and of itself is working, and if there's any concerns. Employers over here with direct payments also have to have employers' liability insurance. There are 3 companies that they can buy from. They all have a 24-hour helpline for people who are employing. So if I did have an elderly person who maybe had concerns around a PA's behaviour or concerns around things happening in their home, that 24-hour helpline will give them all of the support and guidance they need as an employer, all the guidance they need, which is really good. It ensures they're adhering to employment law as well, which is a big thing. So there's so many facets to it. It has its benefits, and there's also the drawbacks in terms of the regulation. If they come across our door, we support them as best we can, but there are definitely people who slip between the cracks, who fall under the radar of us and who don't get the signpost to take our advice and support.
Okay, thank you, Carla. And Elizabeth, again, on a similar question in terms of the impact on older people, what are your views around the lack of regulation for personal care assistants working in an employment situation with an older person? What would you be particularly concerned about?
I'm definitely concerned about putting vulnerable people with vulnerable people. So someone that doesn't have the full capability of understanding how to care for an individual, possibly not looking at the situation in a holistic or transparent way, and maybe putting their thoughts and feelings before the individual that they are caring for. So that may be that they decide that what they feel is the best choice for the person that they're caring for, whereas actually that's not the way a carer should be looking after an individual. It should always be the person first, person centered. I think that it causes a risk where people are not aware enough about fluid intake. You know, not having just a simple thing like having enough fluid in your body can cause impact, can send you to hospital. It's a whole series of knock-on effects just from not having fluids in the day. And there is nothing in the care certificate that talks about fluid and nutrition and intake and things like that. So there are lots of areas that are being missed throughout the training when an individual enters into a care home setting, which means that they are not equipped with the skills, tools and the capability and the knowledge to provide the care to the individual.
Okay, thank you. And I suppose leading on from that, how could we ensure that personal assistants receive adequate training to prevent the risk, particularly the risk of abuse when caring for older people? Carla, any ideas?
Well, for personal assistants, I suppose, again, you could have maybe a mandatory training or a set training regime agreed at Health Trust level that has to filter down. So if you're becoming a direct payment employer and you're going to recruit a personal care assistant to come in, that there's a standard of training that has to be delivered before that person takes up their employment. Inevitably, though, that would delay the support coming into that person because that training will take a set amount of time. And we're particularly seeing a lot of at the moment due to the healthcare crisis that we're in right across the UK. People are coming home from hospital with emergency discharge direct payments. So there's no time to train staff. Now, those typically will fall back to family to provide that care when the person does come home. But in the longer term, it's about, for me, putting in some kind of mandatory training so that at least there's a minimum level being met, which is what care assistants working within a care providing organisation here would have to have. It's basic manual training or manual handling training. Now, there's more specialised training like dementia training, and we could have medical tasks training, catheter care, and all of those kinds of things. But I think a basic standard of training. Now, I think to be registered with NISC over here as a care assistant within the work environment of a care provider, you do have to have a certain level of training. I believe it's the health and social care level 2, 3, 4, they go up through the ranks. So it's maybe some form of standardized training across the board. That brings its own issues in terms of time effectiveness for someone who urgently needs a package of care through direct payment, but at least some form, because you will get PAs whenever I do help people recruit quite often, and the application will go out very specific to what your care and background would be, for example, and we would get applications from people who have no care and background at all. So and if we weren't helping that person monitor those applications, and they're taking that person in, they're coming in with very, very little care and background. So as Elizabeth had highlighted, fluid intake, medication needs, as someone taking their medication, all of those areas around care within your own home they're not trained on. So it's quite frightening. So some standardized training would be an idea. Would that cut off the workforce in terms of choice, control and flexibility over who you employ? Quite possibly. So it's a rock and a hard place situation.
Yeah. Okay, Elizabeth, anything that you'd like to add on the
I think standardized training is definitely a must within the system. At the moment, the care certificate takes around 12 weeks anyway to complete. So, I mean, that's quite a significant amount of time. And within those 12 weeks, if they were trained on the various areas, as Carla mentioned, medication and fluid we've talked about, and well-being, mental health needs, etc. If all of that was included within that 12 weeks, just with on top of the care certificate and other things that we can learn through that time, I think an individual would then be well prepared to be employed as a carer. And you say between a rock and a hard place, but I would rather have an individual that's been trained consistently for 12 weeks and come and work with me who's fully aware and capable of their job role than somebody that hasn't had that training and has come across to support me. Recently here in the south of England, Gillian Keegan launched the new nurse college. So we've got a new nursing college here. So why can't we do that for healthcare assistants? Nurses receive so much training and they're put on a pedestal because Florence Nightingale did that for them. And that's exactly what we want to do for the healthcare assistants, is bring them up to standard and put them on the same pedestal as nurses are. So I feel that similarly to what Gillian Keegan's done here is to open a healthcare assistant college, work with the colleges to bring people through, support the MVQs, get their care certificates completed, and really give them a full hands-on training before they enter the care certificate, and ultimately reduce turnover as well. So we don't get the toxicity where you get a new individual starting the care home, and we'll have all of the older care workers who have been there for a longer time, who may have been, you know, set in stone, and they say, no, we do it our way. Well, I've just started the job and I've been told to do it this way. Actually, I'm going to leave now and go to another place where it's going to accept what I'm doing is right. So we get that turnover where training is not consistent. So that's another thing that would support standardized training, was actually reduce the turnover within the care homes.
Thanks, Elizabeth. Carla, just Elizabeth mentioned there in terms of turnover, do you have any idea of what the retention rate is within direct payments?
I don't think I have any facts or figures for that, Sarah. What I will say is that it can be a challenge for a lot of people. We currently support just under, I believe, 5,000 service users who have a direct payment. It could be a portion of them where the care assistant just simply is not doing what they're there to do. They're letting them down. They're not turning up for shifts. They're unreliable. When they are there, they're not doing the tasks that were agreed as part of their job description. And that causes issues. The caveat being then that person does not have the right, unfortunately, to say to that care assistant, don't come back, because they're employers and they're an employee and you have to follow employment law. So where people are dragged down that road, it can become very stressful for families. And if a family member does happen to say, belong to another one, you know, don't return to my home, you can be taken for unfair dismissal and dragged through a tribunal. So there's all of those kind of areas to consider as well. You know, it's never straightforward.
Generally, would retention,
I think when they settle in, absolutely, like we would have a lot of very long-term direct payment packages and independent living fund, which is a Scottish fund that runs here, which no longer is a new fund available, but it's still here. You have a lot of very long-term employees for sure. I'd say the ones where there's a high turnover, it's usually just that managing expectations. They think they're coming in to do little sits with someone, and it's actually a bit more involved. And that's why we would try to tailor very much job descriptions, because, for example, a care assistant might not want to do personal care. They may have a back injury and don't want to do manual handling. So it's very much tailoring job advertisements to ensure that they're pulling in the right applicants for that job. And that's what we've tried to start to do, that process. There's no standard recruitment training out there. We've kind of created our own version, if that makes sense, taking advice from other organizations, but trying to get the right people on board from the start so that they stay with you. A lot of people do stay a very long time. Yeah. They really do. And they're worth their weight in gold to those people, because they're their lifeline. Yeah. You know, they're their lifeline to staying at home and being independent.
Absolutely. Elizabeth, is there anything you'd like to add to that?
Yes, I just wanted to mention that even though people do leave a care home, they do tend to remain in the sector. So it's all of the people that are in the sector are all just kind of slowly moving around from one care home to the other, might bump into each other at a point and go, oh, so fancy meeting you here. But the Skills for Care say that turnover increased before the pandemic and then steadied out during the pandemic, and then after that ended it started to increase again. So it's increased by 0.5% over since the pandemic, so we're looking at a turnover of 29%.
Wow,
that's
quite high. Yeah, and it's the same for managers as well. Managers turn over at roughly 33%. So the care home that I worked in for 3 years had 4 managers in that time.
Yeah. Yeah, and I would imagine, Carla, and I know you don't have the figure, would be my impression that it's probably much lower with direct payments.
I would think so, because it's not a formal setting through a care home or through a health provider. It's very much one-to-one. So if you click with that, and we would also advise people to have a introductory session with your PA before you've offered the contract of employment, see if they're going to fit, because sometimes personalities just clash and people just don't work together, you know. So it's all about trying to kind of manage that. But I would say that the turnover rate for PAs would be a lot lower than that. I would love to have a figure. Unfortunately, it's just a figure we can't you know, gather the numbers for, because there's just no way of knowing who comes in and out if they aren't in touch with ourselves.
Yeah,
you know.
Yeah, but like you, I would imagine it would be lower than the figure that Elizabeth has quoted for.
I would say it's lower than official, because over here a healthcare assistant is actually a formal care assistant who works usually under the NHS or for a private care home.
Yeah.
So I know even from personal experience with my own family that the turnover rate at the moment, given the way the social care sector currently sits, the turnover is huge. My own sister's a nurse for 20 years and she's completely changing careers, which is a really sad situation. But it's happening because of the issues within the social care sector. So certainly within that formal employment in that sector, I would say the turnover is huge. Under direct payments and self-directed support, I don't believe it would be as much, but then I suppose it's a very different set of circumstances.
Yeah, absolutely. I mean, obviously, we've discussed this morning that personal assistants or personal care assistants, whichever term we use, but those people who are employed directly by older people or their families to provide care are not required to be regulated either with Social Care Council or with any regulatory authority in any of the nations. But could I ask, what do you think would be the particular challenges or barriers to regulating personal assistants in the same way as our domiciliary care workers, care assistants, healthcare assistants, as they're referred to in England?
I suppose the challenge would be when you're going to have a central body who monitors and maintains who those personal assistants are. And then there's the onus on the other side of it that the personal assistants have to register. So we have something similar for domiciliary care providers here, which is NISC, the Northern Ireland Social Care Council. Do personal care assistants have to then register with a body like NISC or an equivalent? Where does the funding for that come from? Do NISC take that work on? I know within Northern Ireland there's approximately on the ground about 7,000 personal care assistants. To register with NISC, you have to undergo, you've obviously to meet certain criteria. You have to pay for your registration every year. So personal care assistants are obviously employed directly by someone who funds that, who monitors that, and who governs that. The health trusts here certainly won't. They at one time did explore holding maybe a registered body of personal care assistants, but it's regulating it. That's the issue. So while it would be great to have that central, and the other challenge to that being that not all personal care assistants, particularly if you are a family member, and that's the difference in Northern Ireland under self-directed support and direct payments, you can employ family. The only rule of thumb is that they don't typically live in the same household as the person in receipt of the support, but you can employ family. So if I or if my granny wanted to employ me as a personal care assistant, you know, do I have to register with a regulatory body? Do I have to undergo all of this training when I know that I can deliver that care? So there's, and if that's going to be the case, then it's going to cut off a huge swathe of people here who can do the personal care assistant work, because if they don't want to do that registration and that process, then you're cutting off that family maybe member who could do it. And then it takes away the choice, flexibility and control. But I suppose harking back to what Elizabeth said, you'd rather have some regulation in place to prevent possible abuse or neglect of care. So it's a very fine line to walk. There surely has to be some roadmap that would kind of walk that line between a very formal registration and something that's, well, I don't like the word lighter touch, but something that's not quite so formalized for personal assistance here.
That still provides a level
of assurance, exactly.
Safeguard older people who may be vulnerable.
Exactly.
Yeah, absolutely. Elizabeth, in your view, how can the challenges and be addressed?
I'll reciprocate what Carla has said. I mean, there are no regulations or regulatory bodies to oversee a register or kind of manage that ongoing monitoring of people who are signing up. But I definitely think it's something that's necessary and something that needs to be ongoing. It's definitely something that Nightingales Army are going to be looking into. We would like to, when people come through and we provide them training, then put them onto a register where we can monitor what training they've been provided. They can then take those certificates to whatever care company or individual that would like to receive care from them. So they've got their statements there, their certificates and everything like that. And then we can monitor the register and see where they're working, for what period of time, you know, have they moved on to another location? What was the problem with their previous place? And then we can start highlighting concerns and inconsistencies through the services that they are working in. So it's definitely something that we have at the front of our minds. But yeah, as Carla mentioned, it's not going to be the easiest thing to do, because it's kind of that ongoing monitoring and making sure that everybody's signed up and everybody's taking part and being a part of it. So something that's definitely needed, but yeah, we haven't quite got to the bottom of that yet.
Yeah.
Have you any ideas how it might be addressed? Is there anything that even ourselves as a charity representing older people specifically, and obviously when we talk about personal assistance and direct payments and self-direct support, you know, it's not just older people, it's younger adults with physical disability, learning disability, mental health, you know, could be a wide range of vulnerable people. But I'm just, because we are a charity focused on older people, there's something we should be doing, should be lobbying in terms of trying to get these issues addressed.
Certainly for within our health trusts, I'm trying to think of what the ideal scenario would be. Certainly, you know, not very heavy registration. I do think that, I mean, is it possible, for example, we're contracted by the Department of Health to provide this advice and support service, but no one is obliged to use our service. You know, they're signposted sometimes by family, friends, people they've known out and about, or they're maybe signposted by their local health trust. Something like where a direct payment can progress until you have met with an organisation such as CIL or any others out there, Disability Action, or someone who is able to keep you very much very specific and delivered training on being safe when you're recruiting, how to recruit safely, you know, and all of those, getting your character references. I know that that's not the be all and end all, but it certainly will put in some form of protection, that you at least are bringing in someone who can validate, who is validated by references and by their police check and following things, you know. So maybe some form of standardized referral system for anybody undertaking a direct payment or self-directed support. A standardized referral must be in place to enable you to ensure that you're doing everything safely and that you're safeguarded, rather than just being sort of told you have a direct payment, go out and advertise, and you putting out word of mouth in your local area and just recruiting someone in that you really don't know much about. So maybe that, I mean, I don't know if the trusts here would ever go for that or would ever choose to implement that kind of strategy, but certainly it would avoid people that we would see who fall through the cracks, who don't be referred to the like of ourselves, or who just go off and do their own thing. Yeah.
So that's almost like some sort of kind of support network would exist for personal assistance, and you sort of build on that in terms of perhaps facilitating, not saying that the Centre for Independent Living would provide training, but perhaps facilitate access to training by signposting.
Sure. So if you're the person in receipt of support, to ensure that you're kind of protected as much as we can protect you outside it, whenever the service you're in is not really regulated in terms of employing someone, it's nearly like a referral system. So if you work with a domiciliary care provider here, you know, your referral is made to that domiciliary care provider. They take that, they look at your care plan, they put in trained staff. And that's obviously very heavily regulated. Something like that, you know, where there has to be a referral, for example, so that they don't have to use our services after they've spoken with us, but at least they're given that guidance. Because it's amazing the amount of people that we come across that I speak to daily who are like, I've been running a direct payment for 5 years and I've never heard of you. And had I known this, I would have come to you at the start. So I know that our outreach and training, the arm of that has hugely increased this past year, and that's something that we're really working on. It's to raise awareness that there are organisations who can support someone choosing to take a direct payment. So that's a work in progress, and hopefully that will start to signpost more people back our way. But definitely I think that input from the health trusts and from the Department of Health is something that should be considered, nearly like a referral.
Yeah, a standardised referral, that seems a sensible approach. Elizabeth, in relation to England, any ideas perhaps how it could be addressed in England?
I think Carla's got a great point, doing a referral system and raising awareness. It's really a big point of giving people the knowledge to empower them to make the decision, because as far as I was aware, you weren't able to employ a family member to be your PA, but after some research I found out that you can, but it's a very, very long-winded process. It could be very difficult for the individual that's needing to receive that care from somebody, and like I say, it wasn't notified, I wasn't aware of this, so I was thinking the only two routes that could be would get a healthcare assistant through the social care system, or have an unpaid carer, which would be a friend or family member, and that unpaid carer would then have the carer's assessment and the carer's allowance. But then again, that brings on further risk, where they're not then contracted, they're not under duty or obligation to complete or fulfill their role, and they may not work in the individual's best interest. And that's where we come across power of attorney abuse, financial neglect and coercive control, all underlying that, when an individual should just be providing care. So I think that definitely those concerns lie where a friend or relative is caring for an individual, and I think having that referral process and the understanding of what's available for somebody who could go and reach out to a PA who's actually got the training and awareness to be able to provide them that care, and not break down the relationships within their family as well. So yeah, I definitely think a referral process would be a good thing to look into.
Yeah, okay, thank you. And in just on a similar note, I suppose, what role do you think employers such as care agencies, or indeed families who maybe have their relative receiving a direct payment, you know, to ensure compliance in the level of care that's being delivered, and in terms of, I suppose, ensuring that there isn't any risk of the situation being abused?
I suppose from a family perspective, I mean, that really is door to door, what goes in, what level of support someone has from within their family circle. So we would support people where, for example, they live with their daughter, and you know, the PA is coming into their daughter's home to provide the care. That can be kind of monitored by that family, because they're there and they're able to see what care provision is being provided. Even if they're not there, they can have tasks and they can have time sheets, and they can, you know, outline what mum had for dinner. They can be very specific, but the problem lies where you don't have family involvement, and where it simply is down to that person in their own home, that, say, for example, that elderly person and that one person or two people they've coming in per week to provide the care under direct payment, because they are not regulated by their employer. Their employer is the elderly person they're given the support to. So, I mean, if there's no family support, who regulates that? Well, realistically, the only person who would be in that environment, and it's only 6 months and yearly, would be the social worker or key worker who's coming in to review that direct payment. So there's definitely a huge gap there in terms of people who don't have family support. Family support, when it's available, can be a great monitoring device for ensuring that things are going well. Some of our care under self-directed support here, you can choose to take your care provision in a multitude of ways under the one umbrella. So you can choose to have half of your care delivered by a care provider, so say a morning and an evening call. You can then choose to have direct payment workers coming in for the remainder of your calls through the day, or a sit, for example. So I suppose there's an onus on the care companies, if their carers are coming in and if they notice anything, you would like to think, given the training they have, that they would speak to someone who would then probably link in with ourselves or the social worker to say, our carers have raised concerns about a PA that's in that home. But again, you're heavily reliant on that happening. And will that happen, and will they whistleblow on each other? That's another issue. And you have, so it seems a bit defeatist, but there certainly has to be, it has to be acknowledged, there's that huge gap where there's no family support. And someone's vulnerable at home and reliant entirely on that one person. You know, there are no eyes in the sky that's watching what's going on.
Yeah, absolutely. And Elizabeth, your views in terms of the role of families and potentially care agencies to monitor?
Yeah, I definitely think it's under a duty of care for the care agency or the PA to have a complete care package with the individual that they are supporting, so they know the needs, wishes and wants of that individual. And for a care company, obviously they must follow all of their kind of regulations and policies and procedures and things like that, to make sure that they're kind of outlining their roles and responsibilities for what they're providing to that individual, but it does fluctuate, unfortunately. As I mentioned earlier, somebody may put their own personal views across from that. If they are a family member, not a regulated individual, they may think what is the best interest for the person they are caring for. So you can have those discrepancies, which can be very difficult. But I think outlining a very clear care package, having that all written out and so that people can follow that, reduce the risk of any abuse occurring, and reduce any conflict between the person that's receiving the care and the PA, because it's clearly outlined for them to follow. Yeah, I think that's about.
Okay, thanks, Elizabeth. We're getting close to the end of our questions for the panelists this morning, and if I could just remind anyone in the audience, again, if there's any questions that you have or any comments on what you've heard already this morning, please pop them into the question and answer box and we'll address them before we finish this morning's webinar. We had, as Elizabeth referenced, been chatting prior to the start of the webinar, and one of the things interested in was if there what the situation was in relation to personal assistance and direct payments outside of the UK. So as usual, you know, should we be looking a little wider, either to Europe or sort of internationally? And I'd just be interested, because I know, Carla, you mentioned that you had attended an event before. So I'd be keen if you could share with us just what your understanding is of the situation in relation to personal assistance outside of the UK.
Sure. So our organisation attended the European Independent Living event in Brussels just pre-COVID. And that was obviously all European countries who come together, obviously, to raise the profile for human rights and all that goes with that. Speaking to the organisations and the people from all different walks of life and different organisations, there is no standards. There's no quick fix, and there's no one country who has got it right. Every one of them face very similar issues. It's regulation, it's working within the laws of their country, what the regulations are. Some are stricter than others. And I suppose the only thing that I find a common ground among all of that is under, you know, UN, CRPD, and under human rights, pulling together what everyone within a European environment, what those human rights and what those look like, and trying to evolve those within each of our own countries to ensure that there's a standard that's met. But unfortunately, we didn't come across, and I'll double check with my colleagues who were there. I don't believe there were any organisations who had, or any countries who had got this down where everything was where it should be. They all faced similar issues. So it's European wide.
Yeah, okay. And Elizabeth, I'm sure, like myself, you weren't aware of any situations outside of the UK, so Carla has been a font of knowledge on that one. And someone has asked in the question and answer just where the webinar recording will be available after the event, and it will be available through the Hourglass website and the Knowledge Bank. And I think, if I'm right, and he will keep me right, usually if you go into YouTube and put in Hourglass, you can divert through that way as well. So that should be there in the next couple of days. Just before we finish this morning's webinar, and as I say, apologies again, we had hoped to have a fuller panel and obviously represent the other nations as well, because the situation might be slightly different. But I get the impression from both Carla and Elizabeth that probably it's not, I think the same issues are probably like in there as well. Yeah. I don't think we would see wide variations on the issues. And I think what I have taken from this morning's webinar is that, yes, direct payments and self-correct offers great choice and control and flexibility for many people. the same time, there are concerns, I think, being raised that really there does need to be at least some form, and as Carla says, whether we call it light touch or whatever, but there needs to be some form of regulation to ensure the protection of the more vulnerable, not just older people, but all clients who maybe don't have good family or friends support who can be there to keep a watchful eye on how care is being delivered. And just before we finish, we have a chat coming in, and I don't know whether either of you, but I'll put it to you and you can see, if not, we can answer afterwards. There's no specific UN convention for the human rights of older people, although one is being discussed at the United Nations at present. Could this be of assistance in future if one existed?
I mean, it certainly couldn't be. Oh, sorry, Sarah.
No, you go ahead, Carla.
It certainly couldn't be a bad thing to have that. We do have the UNCRPD. We do have the children's rights. Those kinds of conventions are certainly there to give weight to anybody who's lobbying at whatever level, whether it be trust level, local government level, for a change in social policy. They can lend weight to arguments and to lobbying and campaigning that can be done for that. So it certainly would lend weight to any organisation campaigning, or if there were a multitude of organisations, if that convention was there. The UNCRPD has been used heavily to try and change and shape rights for disabled people within the EU or the UN. So I mean, it certainly would be of assistance, I believe, to lend weight to and be there as a bit of a backup to the argument you're having around the vulnerability of older people.
Absolutely. Elizabeth?
Yeah, absolutely. Couldn't agree more. There could be nothing wrong with bringing everybody around one table and all discussing thoughts and concerns and that going forward. So yeah, I definitely think it would be beneficial and something that, if it's put in place, something I would be really keen to attend.
Absolutely.
Okay. Thank you. And just finally, and it's just something that occurred to me. Do we have any evidence, or do you have any evidence of any particular situations that have arisen where people have been left in a vulnerable position in relation to protecting their welfare as a result of not having a regulated workforce?
I actually don't, Sarah, but I actually do know of an example where it was within a regulated workforce.
Right.
So, you know, it just shows, I suppose, across the board that can occur, not specifically within my working knowledge, and I'm 5 years with the centre, and prior to this job I was a regional manager with a care provider for 7 years and managed a team of 100 care staff. So, you know, I would say within the regulated, only one instance I ever knew of, and within CILNI and within personal assistance under direct payments, none that really spring to mind, as you know, there are issues where there have been accusations made or someone felt work wasn't being completed, and that was obviously, we would support them, but it's the employer insurance helpline that provide that support, because they have to ensure they're following employment law. Obviously, if there was a safeguarding issue raised through any conversation with a service user we would engage with, we do have a safeguarding champion within CILNI, and we would speak directly to their key worker or social worker if it was something of concern. If they happen to mention something, we would be very vigilant and open to that and ensure that we report that on. So sometimes we can be the eyes and ears, but not a lot of the time.
Yeah, it just depends.
Yeah.
And Elizabeth, in terms of thinking probably more in your role within Hourglass as, you know, community response and our helpline, is it something that you've been aware of, calls coming through about concerns?
But the care being received by an individual?
So concerns about the care being received and the fact that it's being delivered by an unregulated workforce. So,
yes, I've actually had conversations for both. So I've had people call up with concerns for an unregulated workforce, or maybe a friend or relative that's caring for an individual, and as I mentioned earlier, doesn't have their best interests at heart. There is a neglect element to that as well. So even though somebody who's vulnerable and isolated is relying on this person to provide the care and support needs to them, and everybody extended from that family or group also expects that to happen. And if that isn't happening consistently, that individual is being neglected, but unaware to what everybody else is knowing of, because they believe that PA is coming in and supporting them. So we do sometimes get phone calls of individuals who may be feeling lonely and isolated and neglected, wondering where their PAs are, asking, you know, is this right? Should I be receiving further care? I haven't had a drink in days. I've got no heating or hot water, for example. But I've also had phone calls and discussed with people from regulated care homes as well, where care is not being provided in the right manner. I've had, when working in a care home, I've had residents call 999 because they're lonely and they're scared, and they don't have anyone to speak to, and they may have been sat in their room for 4 to 5 hours before seeing another healthcare assistant walk in. So there are a lot of fears there through people, and we do discuss that quite a lot here on the helpline and within the community response hub. Yeah,
okay, thanks, Elizabeth. And I think that brings us to the end of our webinar. And again, apologies that we weren't able to provide the full webinar that we had intended. But I think, and I hope you'll agree, that I think Elizabeth and Carla have provided a lot of very useful information, very informative. And I think it's maybe something that within Hourglass we may come back to later in the year or early next year, looking at the wider issue of personal assistance, and perhaps at that point looking at across the 4 nations and perhaps wider internationally, in terms, because I think given the current, and I think both Elizabeth and Carla had referred to it, given the pressures on the social care sector and the difficulty in recruiting for care packages, I think we could well see as we move forward, and as a different generation of people come forward, more people keen to have that control, flexibility, and opting have their care provided in the form of either a direct payment or a self-direct support with a mix of economy, I suppose, of support. And I think so I think this field, it's going to be a growing industry, which means the workforce there is going to grow. And I think it's probably, as we have said, whilst it has many benefits for the individual, we need, I think we're right to remain concerned that it's not regulated in any way, that we need to have at least try to ensure that something is put in place to offer a level of protection and assurance. And thank you, everyone, and see you on our next webinar.
Thank you, everyone.
Right. Bye.
Bye-bye.